Hi everybody, I'm Phil Fatica. Welcome back to the Government Channel. Today, tonight, this afternoon, whenever you're catching us on our multiple channels, and I think you know that we're on Channel 9 for some TV sets, and on other TV sets we're at 97.2. That's on the digital side. The program today is something really screaming right out of the headlines today, and it has been for some time. We're talking about substance abuse and drug overdose. Joining us today, two gentlemen who really have their finger on the pulse of what's going on. Sitting in the middle is John DiMatteo. John DiMatteo is the Erie County Director of Human Services, and next to John on your left is Jeffrey Shaw. Jeffrey is the Director, the Chief Adult Probation Officer. That's where the rubber meets the road with Jeffrey, dealing with the human aspect of this. I can't help but notice, before we started on the air, a paper from about a little while ago, the Erie County coroner saying that drugs kill 38 so far in the year 2014. And it seems, both of you, and this is why I called you, John, I thought it's a good topic, that there's a whole lot of this going on, that heroin and drugs, more so than whatever normal is. That you can use that, talk about that for 2 hours, because I'm sure you can.
Sure. We have seen over the last year, especially, the rise in heroin use.
Yeah.
You see it in the newspaper, which raises awareness, which we're all for, that people are aware that it's out there. But the use, the last year, actually up to probably 24 months, we've seen a substantial number of overdoses.
Yeah, and this is not just us, this is statewide, or the United States?
This is statewide as well as along the east coast of the United States.
Okay.
The numbers are all up.
Is it fair to ask you, Jeff, why? Why are the numbers up?
Well, I think because of the availability of heroin in the area that's at a reduced price. And you know, there's been a transitioning from people that have been involved with opiate pain medication who start taking it for other medical reasons. They're not able to, buy the medication on the street or get it from a doctor or emergency room, wherever. So they're moving on to heroin. And the heroin, in order to, compete with the pain medication, the purity and power of it has been increased significantly over the last couple of years.
Supply and demand market?
Absolutely.
Yeah.
Absolutely.
I noticed that too. I think we all would agree, and I'm sure you would too, that a lot of the people who are robbing banks, and they're saying, I'm doing it because it's my drug habit. You rob a bank with a gun, that's 5 years automatically. You show a weapon, that's 5 years. Doesn't matter, right? Doesn't matter.
Yeah, mandatory minimum, either on the federal side or the state side.
Okay. So I think we'll all agree that there is this use and abuse, and it's grown locally. And I guess the obvious question is what's being done to either prevent it, or I don't know what's being done.
Well, from our perspective, I think we would always prefer people get treatment. So we've tried to raise awareness. Back in January, we started the Heroin Overdose Awareness Task Force.
Okay.
And when we announced this, it got a lot of media, which we were pleased about. We were trying to raise awareness really across populations.
Yeah.
And so that we could ensure that the public was aware that this was out there, the dangers of using it. We had over 80 people who contacted our office after we announced this that said they'd be willing to participate.
Big number.
This. That's a big number for really people who are volunteering
Sure.
to say, hey, this is a problem and we want to help.
Yeah.
We've done a number of meetings. We've concentrated on getting some information out to the public, and we've also concentrated on treatment.
Okay. You got a big audience speaking to the public because this goes throughout Erie County. So here's your time to get the message out. I know that you have a brochure that lists, and we'll show you this as we insert this into the editing of the program here. But I want to continue with that line of thinking. So if the person's on heroin or other drugs, and what about the children? What about them? Do they play into this? Their children or children using it? I don't know. Either way you can go with that.
The age of first use has come down. And what I mean by that is the age has gotten lower.
Okay, that's scary.
Quite often, people are identifying the age of about 14 as a first use.
That would be, what, 8th grade maybe? Around 8th grade? Yeah.
And oftentimes, they're accessing opiates, the pain medication, not the heroin first. Okay. And so they're getting it out of their parents or maybe their grandparents' medicine cabinet. They're accessing it through that way.
You see ads doing that.
Right.
On TV.
Right. And an interesting statistic just came across was that 80% of all heroin users started on prescription medication. They were either taking
Wow.
it for a medical purpose and then developed into a situation where they were using for non-medical reasons. So that's the stepping point for the younger people is the pain medication and then transferring to the heroin later on.
Yeah. I'm not too knowledgeable in that area, but what does it cost to get what they need? I mean, based on how much they need, I assume, obviously, but what does it cost? Can you put that in dollars and cents? I mean, they're willing to rob a bank.
Yeah. I'm at the end of the system, okay?
Right.
The probation and parole department.
Right.
The only thing I know about prices, it varies depending on supply and demand, and depending upon how much is out there on the street,
Right.
How much has been removed by law enforcement efforts. So it really varies. I know I've been told that certain drugs in larger cities are cheaper, and it's brought to Erie, and the markup is significant. But again, that's
Compared to other medication
Yes.
types drugs that you might have, the staff who work in the Office of Drug and Alcohol Abuse often get told what people are paying at the times. And they're talking about $15 to $20 a bag. Some people with I'll call it a lighter habit, 3-4 bags a day. Some people 6-8 bags a day.
Wow.
So
That's every day.
that's every day.
Yeah.
And believe it or not, that's actually cheaper than other drugs, cocaine, or something else that you might be using.
Broader picture. You cannot escape watching some programs on television where the solution to all of your problems is medication. I mean, are we a medicated society that just tends toward looking toward that pill's going to fix this arthritic ache? Or then they always list it with, but be careful, you might die if you take this. I mean, is it any wonder that people move in this direction? Or no? Toss-up question.
Possibly. I mean, the medication is readily available.
Yeah.
Jeff has noted that most users have noted that they have used some other prescription
Right.
medications first.
Yeah.
And oftentimes we talk about, and this is not to poke at the dental profession,
no,
but
no,
you
no.
go to the dentist, you have a tooth removed, you get a script for a number of pain medications, and so you take them
I did.
for a couple of days, and
Vicodin,
yes, and then you put the rest in your medicine chest, and you don't use them.
right?
And
And they don't go stale.
not very
Not readily.
not very
Not readily.
quickly.
They have a
but
long
that's-
half-life.
Yes, but that's part of I guess Jeff was alluding to, and you mentioned that there is a commercial that's on television that shows a young person and an old person in the mirror, and they're showing the older person's medication being taken by someone younger.
Yeah.
That often happens with these types of medication, and that's one of the things that we warn parents and caregivers and grandparents quite often, because grandmas and grandpas often have pain medication, and they often are the caregiver of their grandchildren, and not just their grandchildren, but their grandchildren's friends that might come over to their home, say, oh, can I use your restroom?
Let me check out the medicine
They
cabinet.
do, and they don't take all the medications. They might just take 1 or 2 of those medications, but it's really an availability issue.
Thank you for pursuing that line of thinking. That was a good one. Just want to hop out of the template a minute here, Jeff. Do you see a lot of recidivism in your job? I mean, yeah, you can tell them they shouldn't do it, and boy, they should quit. But I mean, I smoked, and I know how difficult it was to quit smoking.
Yeah, the probation and parole population has a higher incidence of substance abuse versus the non-criminal justice part. I'm only speaking in terms of adults now, 18 and over.
Okay.
But I think the most important thing to realize is that 60% of the people at the time of arrest test positive for drugs. Now that's not just an Erie County statistic.
Okay.
That's something that's done all over the country. They have drug tests for arrestees, and 60% is a significant amount. And it's really indicative of the issue, because one of the things that John's office does is they do substance abuse evaluations, and we send a very high percentage of our population to John's office. They do interviews in the office and also in the jail, and
Erie County Jail.
Right, Erie County Jail, and that's really the first step towards making changes in people that we have in the criminal justice system that are either abusing drugs or they're addicted to drugs. So really, it all starts in that change process with an evaluation, with an assessment.
Okay. Loaded question, don't mean to make it that way, but is there, in your experience, do certain areas of Erie County seem to have more demographically high concentration of drug use than others? Or is it an equal opportunity offender?
I would say it's an equal opportunity, but the substance of choice varies by location, and that really is the supply and demand, I think, that Jeff has alluded to.
Yep.
Quite often, heroin we were talking about earlier, people would think it would be a more urban drug, and it is not necessarily just an urban drug. It really is across the board in Erie County, often more even in the rural locations.
I would tend to think it's an affluent drug. I can afford it because as many times as I take it a day, I can afford to do that. I have a job that affords me that. So I think the next perhaps inquiry then is the link between what you do and what you do is crime. They seem to be married and not divorcing soon.
Yeah, I mean, it's a very, very common thread in all the cases. That's why, again, we have to have that assessment, evaluation done. And oftentimes we'll find that people that have substance abuse disorders also have a mental health disorder.
Yes.
So we also have to be able to address both of those components.
So the people that you're sending earlier, Erie County Prison, are really behavioral issues and drug issues, not crime issues so much. The root cause is something else.
Yeah, I mean, we could talk for hours and hours about the relationship between crimes and drugs,
Right.
but there is a very high relationship in those two going together. Now, what moves what forward? It's just is it a contributing factor or was that the reason? Alcohol in itself has been shown to be a high connection between violent crime, assaults, that type of thing.
Yeah.
So my experience is that it has, you can't really say, well, I did this because I was high or because I was, looking for money for drugs. Sometimes what we find is that offenders who abuse drugs will stop using drugs before they commit crime because they want to be able to facilitate the crime.
Yes.
So it's a very complex relationship between crime and drugs.
It is. The mental health, can I
No,
jump on
please,
that? In the mental health piece, many of our people that we see have what we would call a co-occurring issue, which would be the mental health and the substance abuse together issue. And we've done some local research, and the numbers are even higher than we had anticipated. We looked at 2-year data just recently showing those who have had a substance abuse issue and also had a mental health issue, and we were in the 80th percentile, which was, I was personally guessing a much lower number, more like half, but it even is surprising to us who've been doing this.
Does this ride any sort of a bell-shaped curve, or does the economy play into this? The war, culture? Do we go up, down? Or are we going up, 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 up? Or are we flattened out? Or if you have a stick that you measure by, 10 years ago, were we worse or better?
I don't think the number of people we see changes entirely. I think the substance of choice quite often changes. And
I agree with John. That's very, very much so. And back in the 80s, 90s, it was crack. And then
cocaine.
We've seen that transition to other areas, and then we've seen for a little bit in the 90s, early 2000s, we've seen a lot of hallucinogens on the market, and then again the opiates came on later on.
What drives that? Any idea? I think of the Breaking Bad, the show where meth was, I mean, it became a huge show. The guy's dying of cancer, and he decides to take care of his family by cooking meth.
Yeah, that's the other drug I left out. That,
Okay.
Yeah, I mean it's really
It became like an anti-hero.
Yeah, what happens is, in my experiences and seeing it all over the country, is that some drugs were very, very popular and then fade out, but not completely fade out, and they'll still be, and then suddenly there'll be there will be a resurgence. Certain drugs will come back; they'll be in fashion, and then people will be getting involved with that. And but they used to say, well, people who become dependent on drugs just use certain types of drugs.
Yeah.
Well, that's really not what we're finding. Is that people will move around with different types
Different
of drugs.
substances,
Yeah.
yes. It's changed quite a bit. We actually saw a small spike in what we'd call synthetic drugs, in the past few years, that people have been reporting that as their drug of choice. But it didn't, heroin seems to have pushed that out. We've also heard that crack is also becoming more popular again. Meth, I don't know, ever made it to the height of popularity here in Erie County. Some of the counties just south of us, much more popular there.
The reason I heard was there's a lot of space. You can brew it. You don't smell it so easily. It was ideal for doing that kind of a drug. Yeah.
Yes.
I'm sure a lot of you maybe have heard in the media, either press or electronic, about drug courts. Could you elaborate on that? Because I think that's a great thing. Drug courts.
We have in the United States about 3,000 drug courts. They all started. First drug court was in Miami when they had, in the mid '80s, where there was an explosion of crack cocaine in that area, and it's been spread all over the United States and actually over in other countries. But the idea, the basic premise of a drug court is you have the supervision of the court married together with the treatment aspect of case managers and treatment professionals working together, and the incentive for the offender, because again, in vast majority of drug courts, people will opt in, will apply, and if they meet the assessment criteria that they need the treatment, then they're placed in a drug court, which means they avoid going to jail or they're released from jail. And these are people that are, as I said, 100% of emphasis on treatment, drug screens, making all their appointments and doing all that. So the drug court works together as a team to help the offender, support the offender and get them off on the right track.
It has the leverage of the court,
Yes.
and the treatment aspect that we're looking for.
Yeah.
Yeah, and it's really in all drug courts, and in particular here, it's really a team approach where you have everybody working together, and the judge is essentially the leader of the team.
Yeah.
And works with all.
And we
the
have that in
professionals.
Erie County.
Yes, we have it. We've had it since 2000.
Okay.
Yeah, we've had it.
Successful?
It's been successful, and we've pretty much followed a model that is used all over the country. So there's strict guidelines as to, because it has been successful, and the data has shown that all throughout the country.
Okay. What are the challenges then, John, of getting the offenders into treatment? I mean, you're there, I'm here, so what? Come on. I've heard your line before.
Well,
Not you personally. Don't take it that way.
Quite often, and I think both of you have alluded to this, probably 2 out of 3 people who walk in the door at the Erie County Office of Drug and Alcohol Abuse are there because they are what we call leveraged by the courts, by their parole officer, by the probation officer, by a judge. So 2 out of 3, about a third maybe just walking in because they've decided to make a change. That's how hard it is for people to make a change. And it is not as often we'll call it willful misconduct that people think that it might be.
Yeah, and I think that we've seen exactly what John said, is that there's an assessment. It's shown that they're in need of treatment, and the person, I don't have a problem. I don't need any treatment.
Right.
And then the other thing is that having coverage. The coverage. How do I access it? I mean, there's a combination of that. That's why we work in conjunction with the county drug and alcohol office because they have the funding available, they have the expertise, they can get the person into the right level of care that they need. So there's a lot of parts that have to put together. But the biggest thing is people say, well, where do I go for help? I mean, this is just for anybody. Where do I go for help? Where do I go assistance? I have this problem.
Right. This is available. I have this brochure. We'll get this up on the screen for you. Run that camera there. And that would be for the drug and alcohol abuse case management. That's right there at 155 West 8th, the corner of 8th and
Sassafras.
8th and Sassafras. This is where you can find us. You can tell anybody that you know or you yourself that what they need. This is available free.
For the most part, free, yes. An
Yeah.
assessment is free, depending upon if you have private insurance, that would come into play. If you are a medical assistance recipient, generally it will cost you very little to nothing for any type of treatment that you'd receive.
And it's confidential. That's an
That's-
important
thank you.
thing because
Yeah.
because of the stigma.
Extremely confidential.
Because of the stigma
Oh.
that we have to really make sure that
Lose my job.
yeah, people
Lose my
understand.
my
Yeah,
wife, my kids.
absolutely.
Yes. The
Yeah.
other thing, I guess, to point out related to that confidentiality is I know that the staff in our office have often gotten questions that if you're a parent or a loved one who says, hey, my brother Jeff
Yeah.
really he's using, are you going to have him arrested if he
Yes.
shows up at your office? And the answer is no, we are
Good
not.
question.
And I've had that question many times from friends and people in the community saying, hey, I don't want the person to come to you because you're going to have them arrested, they're going to go to jail. And that's not what's going to happen.
That's not what's going to happen. Or a parent doing that to a child, saying, I know they're doing it. He needs help, she needs help, and I'm willing to do this. One of the questions I had was that there is a drug that can be given to stop heroin overdose. Any comments on that?
Sure. There's naloxone or Narcan, it is called.
Okay.
It would actually stop an overdose sort of in its tracks. It stops
Wow.
the effects of the heroin on your body.
Okay.
In many cases, I know that our guards at the prison have used this at times. The people who are in emergency care would have this with them. There's some legislation out there that will, in some states, that allows persons to have this.
Do we have it?
We do not have that in Pennsylvania yet.
Okay.
That's one of the things. It's controversial because some people see it as an escape hatch, so that I won't overdose and die. Quite often, someone who is using, whether they're an overdose or not, you can administer this medication, and it stops the effects of heroin. The user doesn't want you to stop the effects of that use. So quite often, it's a challenge with this medication.
This is John DiMatteo. He is the Erie County Director of Human Services, and sitting next to John is Jeff Shaw. Jeff is the Director, Chief Adult Probation Officer. Jeffrey works in the courthouse, and John works a couple blocks away on
West 9th Street.
West 9th. But their jobs interact. They do come together. Was it always, let's say 100? Let's roll back 100 years. 1914. You had the war. You had Prohibition coming out of that. You had the Depression. So we've gone through these cycles where people self-medicate or look for escapes or look for any kind of a drug, and we're just riding the crest of or the downside of, I don't know. Are we like this, or are we going up and placing us in the United States? How are we doing as far as Pennsylvania, Erie County? Are we the bottom of the rung and we're getting worse? I mean, there's a lot of questions there, believe me. More time than we have to answer.
I think the one statistic that sticks out in my mind is that we consume the most drugs of any nation in the world. And we're only 4.6% of the world population, and by far we consume
Would
the
alcohol
most
be
drugs.
considered?
Alcohol is different. I'm talking about, even though alcohol is a drug, I'm just talking about non-alcohol type drugs. But yeah, I mean, well, the alcohol thing, that's a whole different, conversation.
Sure.
But yeah, I mean, it continues to rise, even though I just read most recently that among young people, drug usage is down. That's a study that just came out.
Okay.
And I know that
Pennsylvania
John
Youth
saw it.
Survey, yes.
Yeah.
I read too that smoking among young people is down for the last 10 or 12 years, 12, 15 years.
We do a number of prevention programs in the schools. We have a student assistance program that is available to any student in any school. We talked about getting help. That is one venue for kids to get help, or for parents to make a referral to get help for their child. They can go to the school guidance counselor, and they do what's called a SAP referral, which is the student assistance program.
Student assistance, yeah.
And that would be the entry to help. And so kids would not be charged for any services, et cetera.
I am a grandfather, you know, and I know that my grandchildren are going to face this as they grow up, and it's scary. It's scary, you know. I think you're a father. I'm not sure if you are or not, but it's scary, you know. And you start talking about this, and you just wonder, the temptations out there are so great, you know. Here's the big question they pay me the big bucks for. How do you avoid that? What's the advice, Dad, Grandpa?
I'll take
Mom?
that first and then pass it on to John.
Okay.
I think again, it all starts in the home.
Okay.
And you know, having that discussion. And now the discussion is even more complicated because now the kids know about medical marijuana, about recreational marijuana in these different states. So it's even more complicated now about it. So I think the other part is prevention. And unfortunately, that's one of the first programs that get cut is prevention programs. So if you can delay that first usage to 18, 19, 20 years old, you have a less of a chance of someone becoming dependent on drugs.
That's the gateway, that age, approximately there. It's that old Fram filter, pay me now or pay me later, better to pay me now with prevention. John, you're rounding third here, heading home.
I would agree with Jeff. I think conversation. You have to have honest conversation with your kids, your grandkids. If they have identified to you that they've used something or tried something, it's not the end of the world. If they're addicted to something, it's still not the end of the world. We have treatment programs that are in place to help them. It's important, though, to have that conversation. If we could say it over and over again, you really need to talk to them about it.
Great advice. I'm glad you said that. It's not the end of the world, and there is help. Thanks for joining us today, you too. And thank you for joining us, too. Remember, this conversation is the Erie County Office of Drug and Alcohol Abuse. It's at 155 West 8th Street. We'll put that up on the screen for you along with the phone number. Thanks for joining us. Great conversation about drug and substance abuse in our community. I'm Phil Fatiga. Till next time, take care.
You're watching the Mill Creek Government Channel, powered by WQLN Public Media.